Hi, and thank you. I'm Carol Head, the President and CEO of the CFIDS Association of America. The mission of our association is to make ME/CFS understood, diagnosable, and treatable. We're primarily a research organization. We fund research aimed at the early detection, objective diagnosis, and effective treatment of ME/CFS. We do that by pulling together public and private funds and dispersing it to the best ME/CFS researchers. We're pleased to have worked with the Let's Get It Right group as we prepared for this presentation. Our involvement with this IOM process stems from our desire to inform the regulatory framework to accelerate approval of ME/CFS therapies. The development of safe and effective treatment for ME/CFS requires strengthened, uniformly accepted criteria that can be used consistently by researchers, clinicians, and patients. The lack of uniformly accepted clinical diagnostic criteria is one of the many reasons for the slow progress against this illness. The FDA has stated that when there is confusion, lack of consensus, and no progress, go back to the core. And the core regulatory framework for any disease is core signs, symptoms, or decreases in specific functioning. The FDA recognizes that ME/CFS, we are still at a very beginning and understanding of the core. We applaud HHS's effort to address this critically important issue. And at the same time, we anticipate that your work will be extremely difficult, despite your best efforts, because the available research is more limited than any of us would want. Despite agreement about the best way forward, we all acknowledge the need for evidence-based, broadly accepted clinical research tools that can accurately identify all of the subsets of this heterogeneous group that presents under any of the case definitions of ME/CFS. We believe that the Canadian consensus criteria can be optimized as a clinical case definition by applying a standard methodology, validation of data, and nationwide dissemination to health professionals. We all understand the urgent desperation of this situation. It's imperative that the patient's journey to diagnosis and treatment is faster and easier for both the patient and the physician. Our next slides will document the patient experience and make that painfully clear. This month, the CFIDS Association conducted a survey to understand the patient's journey with ME/CFS. Of the 256 people who responded, 88% have been diagnosed with ME/CFS by a physician. 36% said that it took between 1 and 5 years to reach a diagnosis. 21% stated that it took 5 to 10 years. And nearly 12% waited more than 10 years to be diagnosed. This is a desperately long time to live with pain and impairment without validation. The majority of patients saw more than 4 doctors to get to the ME/CFS diagnosis, and this implies time lost, quality of time lost, quality of life lost, demoralization, and precious dollars spent. Further, the longer it takes to get a diagnosis, the worse a patient gets and becomes even more difficult to treat. One of this panel's charges to get at a good diagnostic criteria into the hands of all physicians is imperative to faster diagnosis and therefore better care. Over and over again in this survey from patients told us stories of delayed diagnoses, lack of treatment, the need to educate the doctor, increased disability, and even hostility due to physician lack of knowledge and empathy. Patients spoke of the unfortunate ignorance of some in the medical community. I have here some patient quotes. Quote, "I've searched and searched in my area and cannot find anyone who knows anything. At first I read as much as I could about ME/CFS, but eventually the whole process got too exhausting. I feel that the medical world has failed me and I've pretty much given up hope." Another, "Even though I've been diagnosed by a healthcare professional, I've had other healthcare professionals question the diagnosis, express to me that they don't believe it exists and don't appear to understand it." A couple more quotes. "I saw some of the best diagnosticians in my area, and he was not able to recognize the symptoms that I was describing fit under the ME/CFS umbrella. And in fact, they're very common without illness. Another quote, "It's up to me to teach the GP about the condition." That is, the patient has to tell the GPs about the symptoms, that the symptoms point toward ME. If I didn't have the knowledge of the experience of ME, I might not have had the possibility to get diagnosed. And as time is short, I will let you read these yourselves. I do urge you to read the hundreds of thoughtful comments that were submitted to us, and we've made those available. These come directly from patients. What's most striking about them is the consistency of what we heard from literally hundreds of individuals who write very gracefully that they've had an extraordinarily difficult time getting to diagnosis. And it is heartbreaking to read those comments. And at the same time, it's imperative to develop and disseminate a consistent diagnostic criteria, and we know that time has not stood still. The few clinicians who specialize in ME/CFS have developed solid intuition and are now treating a few patients to mitigate their symptoms. This is far from a cure, and the situation is not ideal, but treatment is occurring and should not be ignored. Wanting to better understand ME/CFS clinicians' intuition, in 2012 we conducted a survey of 25 physicians, I believe some in this room, how they treated their patients' symptoms. This chart shows how the CFIDS Association survey, some of the association survey result. The horizontal axis lists symptoms. The vertical axis is the effectiveness of the drugs used to treat each symptom. While you probably can't read the symptoms from there, I can tell you that each dot represents a drug that was identified by 5 or more clinicians as having a positive effect. So we see that there are a number of drugs used by knowledgeable physicians that effectively treat symptoms. We show this data to illustrate that diagnosis, management, and treatment of ME/CFS, while woefully inadequate, is possible even now for those few patients who can find and afford an ME/CFS expert. Several physician surveys were involved in drafting some of the diagnostic criteria in use today. Good clinical diagnostic criteria in the hands of all physicians will result in scale and reach so many more patients. And going even further, good clinical diagnostic criteria will lead to biomarker discovery. This slide is the result of research funded by our organization that's being prepared for publication. Blood samples from our Solve CFS BioBank were used in this research. The samples were selected using the CCC. The horizontal axis shows 100 different genes, and the vertical axis shows whether the sample was from an ME/CFS patient or a control. We've drawn that horizontal line to help delineate where the pattern changes between ME/CFS patients and controls. Look at the pattern of the green color. And as you can see, the majority of ME/CFS patients above the line are distinct from the majority of the controls below. It's noteworthy that these samples came from patients being cared for by expert ME/CFS physicians who use current clinical diagnostic criteria. Again, demonstrating that clinical diagnostic criteria is possible for ME/CFS. The credibility and authority of the IOM committee is important to making ME/CFS widely recognized and diagnosed throughout our nation's community, and that will help the 1 million Americans who struggle with this serious illness. The success of this committee is of great importance, and you have an unprecedented opportunity in the history of ME/CFS. Thank you for this opportunity to convey the CFIDS Association's research-driven insights and perspectives.
Thank you so much for your presentation. I do hope your group will make the research that you've conducted so far available to the committee to examine. That would be great. Lily?
Hi, I was very interested in your data looking at how long it took patients to get diagnosed and the number of physicians they had to see. Back in 2008, I contacted ProHealth, which is a supplement company, and they had a huge online forum at the time. And I asked patients similar questions. We got 2,000 responses online, very similar to the results you're seeing. One of the things I wondered about was if you have any information on duration of illness and if people who have been sick for a longer period of time were had more difficulty getting diagnosed in the past versus people who are more recently sick? I'm trying to see if the shift in diagnosis has gotten any different.
Yeah, I'm happy to provide you with the full results of the study. I don't believe it's going to answer the question you ask in terms of first off, it's not longitudinal, and second, we did not explore how long an individual has had the illness. So, but I'm happy to share what we do have.
Well, thank you so much. I really do appreciate your sharing your data with us. It's been very helpful.
Sure. Well, thank you so much.
Thank you. Okay, next we're going back online to speak with Pat LaRosa from the New Jersey Chronic Fatigue Syndrome Association.